I have had very good experiences at the NHS Health and Social Care.
I think the positive thing for me was actually finding out that I was type 2 diabetic. It was a shock, and it meant I had to seriously look at what I was doing.
Things like direct payments for getting my personal enabler to help me.
The people that actually do know about it and understand it are really incredibly helpful.
I have had no problems with the care I have received.
It just takes too long to get answers. I've been waiting nearly 5 years now to get a diagnosis of what's going on, and I still don't know. They don't see you as a person. I think you're just seen as another number. Being
diagnosed, you don't really know where to go to find that information.
So I would have 6 sessions of physio, and just when I was feeling better and getting to grips with it, the treatment would stop.
You have to second guess where you're going to be in 6 months' time and what help you're going to need in 6 months' time.
It takes you 4 months to get seen for the second time.
You have to find these things yourself. The NHS don't give you a list of what's available.
Everything I've done to combat this illness, I've managed to find myself. I use diet, exercise, positive thinking to maintain this illness, but none of that's available within the NHS.
The time it takes to get anywhere, to actually, put the wheels in motion.
Continuing the treatment and keeping it consistent would help people to be rehabilitated.
Being able to talk to other people fairly quickly, having been diagnosed, so that you can actually have a support group that you can go and talk to.
It's frustrating being in the medical system when you're a complex case. Yeah, and no, I just wish there'd be enough people to help.
You do want all the doctors, nurses, or whatever to look and listen to their patients rather than just read their IT screens.
What they've got to be is consistent over the services that are offered and the drugs that are available. It's caught up in the postcode lottery.
That instant education is what's needed for everybody that has diabetes. They should instantly be sent to a support group.
It's a constant battle finding funding to keep this facility open and also to keep expanding the services that we offer. I would like to actually see either available through the NHS or the NHS got involved in projects like this that are working grassroots with people.
I think with the doctor's surgery, when you go for your checkups, it is only a 10 or 15 minute consultation, and it's not really long enough to find out all that you want to know.
Actually, I'm the expert because I'm the person who lives with it every day.
It is important because you know how people are getting on and you know how well the service is performing.
It comes back down to that thing of we're all unique.
We're the people that are in the firing line, aren't we? We're the people that are experiencing the situation. And, I actually think that people that are at the top that make policies should actually get out onto the ground floor and come out and visit facilities like this.
A number of people are frightened about the future. Diabetes is such a ticking time bomb in this population.
But it is something that will break the bank for everybody.